One of the most common things that I deal with as an oncologist is taking care of patients in pain. And it's a very common question and concern from patients about, will I be in pain? How will I feel through a terminal process and near the end of life? And a lot of concern in being in uncontrolled pain, unmanaged pain. And I think that what I always tell patients is that we can confidently control your pain. We live in an era where we have enough medical advances and enough pain medication, enough expertise to be able to manage that and help control and ease people's suffering. I think it's difficult enough, to deal with your own sickness and sometimes your own mortality, and to be in chronic pain. And I think it's something that's not frequently spoken about. It's something that's very private, very scary. And sometimes as a patient you may even feel some reluctance or stigma even speaking about it with your physician or your nurse practitioner. And it's something that doesn't have to be that way. We have the tools to take care of pain, to ease suffering, to take care of shortness of breath, to take care of a lot of other bodily symptoms that unfortunately are part of the natural end-of-life process. And it's important that you bring it up with your physician and nurse practitioner or PA, because we're people too, and we sometimes have a little, there can be a little bit of reluctance to bring that up, or a little bit of fear, and we both get over that hump and are able to take care of you. The other important thing to know is that with an illness that may be a terminal illness is having hospice involved. And hospice is a service of dedicated nurses and physicians who have expertise in taking care of people who are near the end of life, people who are in pain, people who are suffering, and using these tools to ease that suffering. So it's one of the many advantages of having that service and asking about that service, because again, it's sometimes a little bit difficult to start that conversation, but once you do, there's a way to help you.
For more information on this topic or other topics, please check out the other areas on the Coalition website.